Welcome back to Better Arizona. I'm Sarah Carlstrom. It is one of the most popular cosmetic surgeries around, but boy, have things changed when it comes to breast implants. And today we're going to learn all about it from Dr. Richard Fisher from Peoria Cosmetic Surgery. And hi, Dr. Fisher. We've got a lot of information to go through. Why don't we start with this?
Okay, I thought we'd talk about the differences in implants and how we put them in the body. This here is a silicone implant. It has a silicone gel polymer shell, and it's filled with silicone gel.
Okay.
The other one used in this country, but not so much in most other countries, is a saline. It came along when this was banned a decade or so ago, and it is the same silicone polymer shell filled with saline. We fill it through this little port, and this is the deflated implant that we roll up and put into the body, into the plane wherever we're going to insert it. After we decide which implant the woman wants, we decide how we're going to put it into the body. There's 4 major sites where we can insert the implant: through the armpit, through the nipple complex or the areola, under the breast, or even through the belly button. Only saline can go through the belly button. The others you can put silicone or saline. The implant sits either behind the muscle, that is the pectoralis or chest muscle, or it sits above the chest muscle. This is below the breast, this is below the muscle. The most common position in this country is under the muscle through an incision here.
Okay.
And that allows the muscle to conceal the top part of the implant. So if a person is very thin or very young, we prefer it under the muscle. Older people have a little bit more tissue, we can put it above the muscle. Both are acceptable. It's thought that there may be less what we call capsular contracture, which is a complication of breast surgery under the muscle, but that is as yet to be established.
Now, doctor, you just talked about a complication. Kind of break that down to us, exactly what you were talking about.
Well, whenever you insert any foreign body into human body, it forms a protective layer or capsule around it. And in the case of a breast, that occurs just like this piece of paper around the implant within 72 hours. For reasons we don't understand, probably infection, sometimes bleeding, this capsule can thicken and cause the implant to feel hard and to be distorted. In those cases, the implant has to be removed and that capsule has to be removed. People usually have some idea of what size they want to be. It is the width of the breast and the chest wall that determines what we can get in.
So let's take us through. You kind of walked us through all the steps, a lot of information here, but bottom line for people who are thinking about getting implants, it's a safe procedure.
It is a very safe procedure. It is a very satisfying procedure, probably the most popular procedure there is as far as patient satisfaction.
So many people are interested in this, like you said, one of the most popular procedures. If you want some more information on Dr. Richard Fisher or breast implants, you can always go to his website at PeoriaCosmeticSurgery.com, and of course he's got tons of pictures on there, before and afters. And again, it's a safe procedure, not a lot of pain anymore, and people walking around looking and feeling fantastic without anyone even knowing that anything's been done.
Bad first week after the surgery, but after that, very, very easy on the patient.
All right, thank you, Dr. Fisher. And Better Arizona will be right back.